All right. Well, I'm going to go ahead and get us kicked off here. Just to encourage folks to find a spot to sit. I hate to interrupt the conversations, but we've got plenty of time later today for continuations of those. I'm Don Neese. I am the director for our community engagement core with the Colorado Clinical and Translational Sciences Institute. And our community engagement forum is a partnership between our CCTSI Community Engagement Core and our Accords education group. So I'm going to start off by inviting our panelists up and just do some brief descriptions. And our panel presentation today is going to be moderated by my colleague, Sarah Brewer, who will introduce herself when she gets up here. So first, I'm going to introduce Venice Williams and Allison Mosqueda. They partner through both prevention researcher for family and child health with multiple projects that include the Nurse Family Partnership that has been going on for quite some time that actually is not just focused here in Colorado, but in other states as well. Here in Colorado, they're partnering with parents of young children, nurse family practitioners, pediatric providers, state policymakers, co-designing and piloting a collaborative model for pediatric care. Here in Colorado, they also participate in the early intervention to promote cardiovascular health of moms and children's, the ENRICH trial. That's testing the effectiveness of an intervention delivered in the home visiting context to address disparities in maternal and early childhood cardiovascular health. Next, and I just encourage you folks to come up and have a seat. Thanks. Yeah. Next, Lisa DeCamp, and Lisa's partner, Dr. Ricardo Gonzalez Fisher, unfortunately had to be away to take care of some family matters, but their partnership centers around addressing health and healthcare disparities in the Latino community, with a particular focus on immigrants, Latino immigrants, who primarily are Spanish speaking. They've worked together for the last 2 years on projects supporting Latinos with brain tumors, and they're just at the beginning of a project focused on service navigation for Latino children and youth with disabilities across the state of Colorado. And then finally, Stan Scheffler and Christy Haas-Howard. Dr. Stan and Christy, they've been working to address pediatric asthma through school-based partnerships. This is a program I've had a personal window into based on being on the state advisory board. It's really amazing work, and this has been stuff that was originally piloted here in the metro area and it now is expanding to statewide work. So before we get to the panel, I just want to thank everybody for being here. I think particularly for the kinds of work that we're talking about, the kinds of work that we're doing, partnerships across this academic community boundary. It's really important that we be together in community with one another during this time. We are, you know, as somebody said at a conference I was at a few weeks ago, we're in the middle of a difficult moment, but the movement continues. And the movement is to improve health for all and to partner across this academic community interface to do that important work. So thanks again for being here. Make sure you get something to eat. And I'm going to hand it over to my friend and colleague, Sarah.
Welcome, everybody. And I just want to echo what Don said. I think this is a really important time for us all to be in community with each other and continue to have these conversations and move all of our work forward together. I am really honored to chat with all of you this morning, and you don't have to turn around awkwardly to look at me. But I do want to note for anybody who is on Zoom, I do have our chat pulled up, and we will have time for Q&A from the audience here in the room and those of you who are attending online. So please hold your questions here, or give me a wave if you've got something really important you want to ask, and I'll be trying to track that in Zoom as well. I would love to start for our panelists here, and you should have hand mics spread out across the table here. I would love to start by just having each of you share a little bit about what you are doing right now with your partnership, and what communities you are actively serving in this space that we're in right now. So I'll start on this end, Venice and Allison, if you want to go first in describing the work that you're doing right now in the community that you're serving.
Good morning. Is it still morning? Yes. Hi, everyone. Good morning. I'm Venice Williams, and I'm with Allison Mosqueda. So our work at the Prevention Research Center is really focused on family engaged and community engaged research. That's over the kind of perinatal period, so pregnancy, postpartum, and kind of like early childhood development. And a lot of the interventions that we do research on, one of the biggest ones that we do is with Nurse Family Partnership, which is, for those of you who are not familiar, is a evidence-based home visiting program for first-time pregnant and parenting people. And it's for kiddos up until they're 2 years of age. And so the research we've been doing over the last few years have been across the country. I'll focus maybe on the Colorado ones today. But one in particular has been focused on what is called the Enrich trial. And Allison can speak to that a little bit more. But it's an intervention to promote cardiovascular health of mothers and children. And so we've been working with clinical centers across the country and also the providers, so the nurse home visitors who are delivering this intervention to their families. In particular, we're partnering with the NFP program here at Denver Health, as well as Invest in Kids, which Allison can speak to more. And so that is the work we've been doing to make sure that this intervention that we are developing and piloting is really meeting the needs of these families, and also hearing the perspectives of the nurse home visitors who are delivering this program. Like, is the work we're doing feasible? How are families reacting to this work, and so forth? I can let Allison speak to that a little bit more.
I'm Allison Mosqueda, and I'm the program director for Nurse Family Partnership here in Colorado. I work with an organization called Invest in Kids, and we are an intermediary organization. So we provide the wraparound support when a program wants to replicate in a community after research. So for Nurse Family Partnership, as we're now replicating in Colorado, we're in all 64 counties. Our support services provide direct nursing consultation, program advocacy, program oversight around monitoring fidelity. So part of my role in working with Venice and the research team here is to really bring that perspective of the nurse home visitors working on the ground. I myself was a nurse home visitor for many years here in the Denver metro area. And it's really helpful, I think, to have myself in that space as a bridge between the nurse home visitors, the agency of Denver Health, and them representing the families they serve to the research space here. And let's see. Some of the population. Yeah, I was going to say some of the things about the population we're serving. So as Venice said, we're serving families in Denver County that are receiving services through Denver Health Nurse Family Partnership. Denver Health Nurse Family Partnership has 20 nurses delivering services to over 475 families throughout Denver County. And what we see in those populations of families that we serve, so for NFP, we serve first-time parents that are struggling with economic insecurity, so have an income below 200% of the federal poverty level. And more than 65% of the families we serve have an income below $6,000 a year. We also serve over 80% of our families are monolingual Spanish speaking and have 3 or more risk factors that we consider a challenge for them when it comes to their health and well-being as becoming first-time parents and learning about how to parent a child. And so I think that that's really speaks to the importance of a partnership between research and the people on the ground delivering the program and really being able to understand the families we serve. Because when we started developing Enrich, one of the things we were really intentional about is trying to understand what it is that actually families and communities need when it comes to heart health. So I think from an academic lens or from a nursing lens, we may have ideas about that, but until we actually know what the real needs are and we speak to families or we speak to people delivering services to families, the nurses that engage with families through a therapeutic relationship as part of the model, we might be off on our assumptions. And so I think that that's been a big benefit is to understand the population and how we take that research, but ensure it's meeting the population needs.
Thank you. Lisa, do you want to talk a little bit about yours and Ricardo's partnership, what you're doing right now, and again, the communities that you're serving?
Sure. So Ricardo apologizes for not being here. And Ricardo is part of Servicios de la Raza, which is an arm of the Mexican consulate focused on health and social services support, among other things, for Latino immigrant families, primarily in the metro area, but really across the state as well. And so the work that we have been doing together has focused both on projects here local to Colorado as well as projects across the nation. And so he and I have worked on a project focused on low-grade glioma, which is a type of brain cancer, and it is sort of an indolent, slow growing life altering lifelong, though the mortality rate is slow, what we think of as the harm or the impact on your everyday life is high. And so we have partnered with community members across the country, people affected by low-grade glioma, to pilot a telepromotora, so a telehealth or a remote navigation program to support Latinos with low-grade glioma, because as you can imagine, if you have a life-altering diagnosis, that makes it hard to work, hard to complete the duties you may have for your family. The need to access resources and find supports is great, but having those in Spanish and similar to Enrich, having those supports that are actually meaningful to families, we can say, well, we think, you need these supports, but until people with the disease who are living in communities tell us what they need, and then are able to interface with people who speak their language and are familiar with their culture, we may not be able to provide the services that they need. One of the things about this project, and really all of the projects that we've been doing, is Ricardo and I are a partnership, but we seek many different external partners. And so for, example, there for the telepromotora program, there is a community agency that will deliver that. And so we have been intentional in really thinking about how do we extend our partnership to other community partners and conduct both research, evaluation, and then capacity building with those partners. What are we leaving with them with at the end of this? Yes, it may provide some financial support at the time, but are they more capable to apply for grants or continue the work after we've finished a particular project with them? He and I currently are partnering on a project focused on disability services navigation, similar to LGG, right? This is a complex, lifelong, very complicated system to navigate for families who have language and income barriers to accessing services for their kids. We've just started that project through some partnerships really with small agencies across the state that have been trying to do this in a very small scale. And so the idea with this project is we will be able to brainstorm with them is how we might create a more sustainable infrastructure that leverages connections and resources across, so that every small agency isn't really acting in a vacuum. And that's something that through work that they've been doing, they've really identified these partners, but there's not been a mechanism to have all of them have said, well, we want to know what's going on over here in Colorado or over here. And we haven't yet had a mechanism to bring them together and learn from each other. So we're really excited about the prospect of this project. And then the last thing I'll say is we really do try to, as I mentioned, think about capacity building, and not only capacity building of the community organizations that we work with, but the specific people that may work at Servicios de la Raza who are coming through as students or other partners. And so we have a project, you'll hear a lot more about asthma later, but we have an asthma project for which we decided a different Servicios de la Raza staff member should participate as our community partner with mentorship from Ricardo to really grow the capacity within the organization. I think probably all of you in community organizations are familiar with, you're asked to do things all the time, and you don't have enough time, and they see you as the representative of that organization. And what Ricardo does not want is that he's always the person from Servicios that is coming. How can we increase the people who are capable of being research partners? And so we are working with one of their staff members, Kimberly Proano, on this other project focused on supporting families in the Children's Hospital Colorado health system who speak languages other than English with their asthma care. And so that has been really one of the greatest joys I have as part of my career as a researcher, is seeing people build their capacity and build their skills. And so that's been a real joy to work on that project sort of indirectly with him, with another person at Servicios.
Thank you. We'll move down to the end of the table. Stan and Christy, I'm really excited to hear a little bit about the communities that you're serving and your partnership right now.
Let me see if this is working. Is it
I
okay?
think so.
It's nice to be last, because I could listen to how you all summarize things, and I'm going to try to summarize 20 years in 2 minutes. I have been involved in asthma research for about 40 years, and doing major clinical trials, being on guidelines committees. And then around 2005, there was an opportunity to develop a school-based asthma program. And I always recognized there was, if you're going to do something in terms of asthma statistics, you got to go where the fire is. And so in 2005, we were very lucky to become acquainted with Donna Shocks, who was the nurse manager at Denver Public Schools. And we were also lucky to get a grant through CDPHE to do the work. And people asked me, what are you going to do? And I said, now that we got this grant, how do we do this? And Donna Shocks was very good. And we were lucky to have that kind of partner that said, asthma is important. Kids with asthma who miss school, drop out of school, get into gangs, and then the rest is history. Luckily, Christy Haas Howard was a school nurse at the time and wanted to join us. She got her master's degree in public health. And we developed a model over time. And Children's Hospital recruited me and Melanie Gleason to come over to extend it into Aurora. And so once again, how do we do this? And luckily we have good partners. And there was one point in time where I think it was 5 years after we started, I was talking to Lisa Sacudo, and I said, what is community-based participatory research? And she said, you've been doing it for the last 5 years. And so we've developed a program to really support students with asthma, and we have a stepwise process to do it. And we were encouraged to go outside of Denver. And luckily there was a dissemination implementation RFA, and we assembled a group of people, Sarah included, Lisa included, Melanie, who's here, and several other people, and we brainstormed how we could extend it outside of Colorado. And that's One of them is kind of still community-based participatory research. The other one's a clinical trial, dissemination, implementation research. And I think what we realized in Colorado, everything's different when you go outside of Denver. The politics, the demographics, the resources are all different. So I'll let Christy say a few words. Glad to take.
Yeah, it's been wonderful over the last couple decades to have a research partner that that cares about the long-term relationship and the long-term outcomes. And so I think that's what's been really brilliant about our partnership. And the population, you know, is that we've worked with over the years started in Denver, and as Stan said, has extended to different parts of the metro area, different parts of the state, and so it's just been a real joy to be able to work. You know, I've been a school nurse in the building. I've also been kind of helping manage the program at the district level, and then work some with the state school nurse with CDE, the Department of Ed, doing the asthma work in different schools. And so that is definitely one of the learnings, is that every community is different, every partner is different, every school is different, even within a school district. And so so it's been really great to build those relationships with other parts of the state, and then also with this long-term relationship, doing the community-based participatory research and the clinical trial.
Thank you, Christy. I didn't prompt you, but that's a perfect segue to my next question. Each of you has a longer term partnership. You know, we often hear of partnerships that, you know, are growing and developing, but each of you has actually been working with your partners for a number of years. And so I would love for you each to share a little bit about how your community and your partnership have addressed the kind of ever-changing landscape around research, funding priorities, and community programming needs, and how you've kind of navigated changes over time, and those changing priorities in the context we're in. Feel free, whoever would like to jump in first.
So a lot of my organizational strategy occurs about 3 o'clock in the morning when I wake up in panic. Thinking about these things, especially currently. And I think the dialogue between the partnership is the key. In Denver Public Schools, it was great because we went all through the stages. If you take EPIS, exploration, planning, implementation, and then sustainability, that's the key, is to kind of have a vision, have goals, try to find the funding, and then innovate all the time. I was talking to Christy before. When you do research, nobody's satisfied with the status quo. You always have to keep innovating, and then the partners have to innovate as well, and buy in and grow.
Great.
And I would just briefly add, for the reality is that asthma, it has been around for a long time and will continue to be around. And so even if funding priorities change, there has always been and will be kids that need support with their asthma care, and need to access the educational environment and have resources and support around that, and need education about how to use their inhaler and all those things. So so whatever's going on in the greater world of funding and priorities, nurses in schools are supporting kids with asthma every day. So that priority doesn't change for us at the building level.
All of that. Lisa, Venice, Allison, anything you want to share about your partnerships and navigating ever-changing landscapes?
Yeah, I think really creativity and openness. I think we're going to have to be especially creative in the upcoming years, but understanding, being open to the changes that the community is requesting, and being creative about what are the ways that you are going to respond to what their needs are at the time. and really thinking about what is the flexibility within the funding pathway that you might have. Is that it's funded us to do this. We can also kind of build in this, even though it's not a primary purpose of the funding, but having that conversation back and forth about what's possible and what is not. And I think over time, we've grown to understand where each of our tendencies are is as far as how we're interpreting or thinking about things. And so really being able to agree to disagree and then come to consensus, particularly when you're confronted with challenges, has been something that's been successful for us.
Agree with a lot of what's been shared. And in terms of funding for implementation of the NFP program, I think has been pretty stable here in Colorado, and Allison can speak to that a little bit more, and has received a lot of bipartisan support, and even at the federal level. I think from the research perspective, it's thinking about how do we frame the work that we do in a way that is still authentic, and we're being true to our work and our communities. I think what's helped is continued persistence and just caring for each other. Like, we're not robots. It's okay to share some of your emotions, and many of us are feeling the same emotions and anxieties, and just sharing those experiences, I think, has been helpful. And that's what's been motivating, I think, for us to continue to move this work forward.
Yeah, I agree with a lot of what's been said here. Funding in terms of nurse family partnership is been stable, and we're grateful for that. But I think what's changed is the dynamics of the communities that we serve, or the dynamics within the context of sometimes the systems, whether it's the agencies in which we're operating. And so, one thing that's been really important, like Venice said, is this really trusting relationship. I think like I trust and the nurses trust that the research team has their best interest in mind, and we, they trust us that we have the best interest of the program and the families we serve in mind. And being able to be adaptable. This is small. One of the things about the Enrich study that was really beneficial for Denver Health is they have an overabundance of referrals coming into the program. And so the nurses are feeling very stressed at times because there's a high capacity, a high volume of people that need to be served. And Denver Health as a county, as you may know, just the context in what we're living in is stressed as well, in Denver Health as a hospital system. And so having the research team not just say we're here to do the research, but also how can this benefit you and some of the challenges you're also experiencing like right now. So having a research assistant that's on staff at Denver Health with the team of nurses that not only supports the research, but can support other wraparound things that are happening within the context of the program has been so helpful. So even that like flexibility to just adapt and change and understand each other's needs is really crucial.
Thank you. All of you, again, have been partnered for a while, and all relationships and partnerships have ups and downs, whether those are interpersonal within the partnership or the context around us. And I'm wondering if each of you might be willing to share some examples of challenges that your partnership or your work together have faced, and some of the strategies that have helped you kind of move through those challenges and also maintain that kind of dedication to the work when things are really difficult.
I'm always the one that is on mute and Zooms. I think there's just a lot of challenges when you have a team, particularly for 20 years. There's a lot of changes. People have children, children get sick. There's illnesses in the family crisis. And I think you have to kind of work as a team and pitch in and cover up and keep the momentum going. I think that, to me, that's a big challenge. Being an introvert is always a challenge, in meeting new people and assembling new meetings. But you just kind of do it, I think, for resilience and persistence.
I'll just briefly, while this is on, that I think one of the challenges we experienced after establishing a really strong program in Denver Public Schools, as we were looking at and getting funding to going to other parts of the state, and really we were talking about this beforehand, just understanding, and I think we both alluded to it, but understanding that we are a local control state. And it's very different climate everywhere you go, and just overcoming that by building relationships with the people in each of the districts and each of those parts of the state, and providers and school nurses, and just listening and understanding. I think that's one of the things that I really value about Dr. Zepler and Melanie and the team, is that they from the beginning, they've come in with an attitude of humility and learning, and are really good listeners. And so I think that's a really great strategy for overcoming challenges, is approaching the challenges with that mindset.
Love that. Thank you.
I'll share one challenge. I mean, I think that we've had several challenges across thinking about kind of who we're interfacing with and how. But one particular challenge that I'll share is that Ricardo and I were brought into the work on low-grade glioma as a supplement to a larger grant. And low-grade glioma has a lot of advocacy among people with a lot with high income. It affects working people, generally sort of 30s and 40s. And so the patient partners and the kind of community work was with a very different community that Ricardo and I had worked with in the past. And so it was this interesting sort of friction of, we had our partnership, and then we're interfacing with other community partners who were from very different communities and had very different views about what should be done or how we should proceed to meet the needs. And he and I really had to work through of what is our approach to advocating for the community that we're working for, and that what we're doing with this supplement just can't be an offshoot or a replication of what they're doing in the main grant, because it won't work. But there was a lot of pressure of, well, we really want the numbers. We want this to, it would be better from a scientific perspective if everything looks a lot the same. And really working together to think about how we frame this, how we talk, how we promote understanding among people who, on not necessarily a team here, this is a multi-site study, who consider themselves sort of experts in community research, but had not worked with the Latino community or other low-income communities. And so that was something I think that really grew our partnership, is facing that challenge together and then having to respond to it.
I'll talk about a challenge not affiliated with the Enrich intervention that Allison's been engaged with, but with another project we've been leading in Florida that is still part of the Nurse Family Partnership Program. I think one of the big challenges we faced there was, we as the lead organizers and are based here physically in Colorado, everything is happening in Florida. And so what was it like we had to develop those relationships with our state partners, state health department, state child welfare, local community-based organizations, and NFP programs that are delivering the intervention, and then also the parents and communities that are affected by our research, and to do that virtually and also continue to do that over several years throughout the span of the project. And so developing those relationships from afar, this was right in the midst of COVID. So people were really starting to use Zoom, but there's also that Zoom fatigue that was happening a lot. So navigating that, but then how do we continue to facilitate those relationships? Maybe the research side of things were stalling. So maybe we didn't need to meet monthly anymore, but how do we sustain that engagement with some of the challenges we had? And so I think what worked well for us is just being open and transparent about some of our challenges from the research process, like what was driving those roadblocks and barriers to why certain things weren't being done. And I think just even basic things of establishing agreements early on of how the team wants to operate together. Like when we're in meeting, how do you want to work with each other? Like how do we make sure the space that we're in is safe for everybody to, contribute equally, from our parents to our state policymakers to our, program implementers who are all in the room together. So I think having those honest and open conversations were really helpful, and updating our partners throughout the process, not just waiting till something's like finalized at the end, but engaging in those conversations throughout.
Yeah, similar to that on the Enrich side, there's been so many times when we probably could have done something faster, but we chose to involve all the necessary parties. So even like bringing the nurses in to give feedback about certain handouts around heart health that were going to be given out to families, and the nurses saying, this handout's not going to work. Like the family, this is not applicable to the families we serve, or the pictures are not relevant, the words are not relevant. And like us as a team going back to the drawing table and saying, okay, we have to listen to this and go back and rework some of this content that's part of the intervention. And I think that's because of like what a lot of you said, having those open, honest conversations and a space of trust to be able to do that.
I had one last question, which was, what new advice would you give to, or what advice would you give to a new or developing partnership? Many of you have already given some pieces of advice, but any final words around, what might help a new partnership kind of grow and develop?
There's always one that lingers in my mind. And it was kind of a test, Donna Shocks, when we first met. And that going into the schools, a lot of people go in with research projects, and they want to do the projects and they want to have people do the work. I found out later Donna was testing me to see if I was in for the long haul, or like Christy said, for the short haul. And if you're in for the short haul, the meeting is pretty short. If you're in for the long haul, you have to kind of make it a mission rather than a project. And that's kind of my big lesson if you want to do this kind of research with communities.
I love that. And make it our mission. Anyone else have?
Is it on? Yeah. I think very similar to what you said, I had thoughts about, you have to keep your reason why you want to do this work at the forefront, and you have to make sure that everybody agrees on that reason. The communities, the families in which you're serving, that they know the why, and that you as the researcher know the why. I feel like there's so many times we have to set our egos aside as like researchers or scientists or academics and say like there's a bigger reason out there, and that's to ensure the people who are most impacted by the work we're doing are going to get the most benefit from the work we're doing together, and they have input into what they need. I think just keeping that, your eye on that focus always especially when you're making hard decisions is important.
Yeah, I think for me is patience and curiosity. I was not a very patient person until now I have a 2-year-old toddler, so that certainly helped. But I think everything's going to take much longer than you think. Like maybe double the time. And especially in developing those relationships early on is so important. And that's what takes the longest time is, doing what you're going to, the follow through and so forth. And then in terms of curiosity, I think it's, as researchers, that's kind of easy for us because that's kind of why we come into the space to begin with. But beyond that is like putting aside your personal experiences and your biases and your assumptions, and coming in with an open mind and an open heart, particularly when what's being shared is in direct conflict with what you know and what you're used to. So I think those would be the 2 major points for me.
Heard a lot of wonderful things. I said a mentor of mine when I was early in my career said you needed to be relentlessly pleasant and persistent. And that has served me well because what we learn often from our community partners is that a process or a system is not working for them, and that we are walking alongside them to change that. And the relentless aspect is needed, as well as being sort of persistent in a pleasant way. Seems to, you win more flies with honey than something I can't remember that. that metaphor. I think these times make it hard to feel like we can continue to be pleasant in our persistence. But I really think as you model as a partnership that we're going to work together to spark change, and we're going to have that as, part of the why. That has been part of the why that's driven me, but that we are going to persist, and that you're there for the long haul to persist in that change.
Thank you all. I want to open it up and see what questions we have in the room. We've got a few minutes to see what else you might like to hear from these phenomenal partnerships up here. If you don't mind speaking loudly, and I'm going to repeat for the mic for those on Zoom. They would come to us after the research had already started or concluded, and they would share with us the challenges that they had. But as we worked with them and we talked to some people that were part of running the Big Advisory Panel, we said, well, why not come to us beforehand? And maybe we have experience in the community as community members that we can give some ideas on some things that may help you to have greater success. So as time went on, that happened, and so we were able to work with a number of them and provide them some of the information that we conveyed. One of the most important things was establishing rapport and trust as community leaders. If you do not have that trust and rapport in community, you're not going to get anywhere with community members, especially if you're dealing with people who don't speak the same language as you or don't live in the same community. So I really applaud you for saying that you have scientific people and that you're working on that to make sure that these are some of the challenges that you may be able to overcome. Thank you. For those of you who are on Zoom, we have Stephanie Salazar Rodriguez, and she shared some experiences working on the Denver Health Community Advisory Panel and moving some of the culture there from people coming after they've started or finished their research work and sharing challenges to trying to get folks and succeeding in some cases with getting folks to come early, build those partnerships, build trust and rapport with community leaders, and a comment applauding a number of our panelists for having multilingual partners at the table to help engage those communities. Stephanie, I hope I did a good job summarizing. Any other questions here in the room?
I work in a lot with rural areas. I work in an HIV and AIDS. So our organization is the only one receive red and white funds outside the Denver area. And be the part educated in prevention, and I have a special class only for women. And one of the things I'm being experiences the researches people don't have in the rural areas. And sometimes when they come in and do any investigation in the research, a lot of times people feel like they don't get anything back, because I grew, I'm a social worker, so I was community investigator in Mexico, rural areas too. So always we have to put the community first to see what they are the needs. Because if we're talking only about what we want to do, we're not going by it. So it's very important to go to the community, go to the cities and see what is the problem. Because like San Luis Valley, I bet they have a lot of kids with asthma there because the environment, right there when people outside in the for areas. So it's a lot of food deserts over there. So really sometimes we forgot. I'm growing in Mexico City, so yeah. But I love rural areas. Yeah, I see really what the big needs, and sometimes people don't wanna do it because they don't feel they can give back. And another good thing I wanna be told you guys is language. I don't only for Spanish, any language. We're going to have a lot of trouble now when to have people translation or do paperwork in other language because not going to be requirement anymore because now English is the national language. So take that in consideration when you guys working when partners because I'm in here from the community already. They told me I have to bring translated with me because they know they're not going to pay anymore for translated because they're going to take the money away. I'm like, okay, so we're going back worse. So when you guys working with any other, but thinking about it, not only in Spanish, because we have too many language here and too many dialects too, and native language that we know. Take care of that too. Thank you.
Thank you. I think we have time for one more question if there is one in the room. Or Donna can hand it over.
Hey,
As I do so, though, I want to thank all of you for being here and sharing about your partnerships and your many wonderful lessons learned for all of us. Thank you so much for being here.
all right. Well, we're going to transition now. And just again, thanks to our panelists. Now we're going to give everybody a chance to mingle and visit the tables from our partnerships that have graciously agreed to share with us their work and the things that they're doing. We do have some prompt questions, and let's see, are those on? Do we have a slide for those? Okay, okay, all right. And I also want to thank our attendees on Zoom. There will be a link put in the chat for our survey, and for those of you that are here in person on tables, please scan the QR code so you can complete evaluations for this. And thanks again for being here, everyone, on this chilly day, and hope you enjoy talking with our partners.